Hi, I'm Dr. Ellie Pack. I'm a radiologist with fellowship training in breast imaging and intervention, and I'm going to continue our talk on breast imaging today. So in part 3, we're going to look a little bit more at breast density, specifically why it matters, why it's important to know if you have dense breasts. Just to recap, breast density refers to the amount of fibroglandular tissue you have on a screening mammogram. Fibroglandular tissue looks white on a screening mammogram, and the two categories that count as dense would be heterogeneously dense and extremely dense. Well, unfortunately, cancer, like dense breast tissue, also appears white on a mammogram. What this means is cancer can be hidden by dense breast tissue. This is the so-called masking effect. Basically, as breast density increases, the ability to see cancer on mammography decreases. I think it's important to mention that mammography is a great tool. It's a foundation tool. But unfortunately, like all imaging studies, it's not perfect. It's not an absolute, like, say, a pregnancy test that's positive or negative. It's shades of gray, literally and figuratively. For this reason, it really is important for women, to know their density and to know the limitations of the study. Another reason breast density matters is because we know that as breast density increases, unfortunately, so does the risk of developing breast cancer. In fact, women with extremely dense breasts, that's the most amount of fibroglandular tissue on the spectrum, have a 4 to 6 times higher risk of developing breast cancer than, say, women who have fatty breasts, those least dense breasts. Most women are going to fall somewhere in between these extremes on the spectrum, but it is important to know that, again, the greater amount of fibroglandular tissue, the greater your risk for developing breast cancer. Something that's important to know is that women who have dense breasts may also benefit from something called supplemental screening. Again, these are additional screening studies which may help in combination with mammography to detect cancers early. We can look at a few of these. The first one, which many women may be familiar with, is called 3D tomosynthesis. At this point, I'd say tomo has really moved from a supplemental study to really a mainstay, something that happens concurrently with screening mammograms for all women. In DC, in fact, all women, regardless of their density, whether they're not dense or extremely dense, can have tomosynthesis with their screening mammogram, and insurance does cover it. Why is tomo important? Well, simply, it detects 1 to 2 additional cancers per 1,000 women screened, and also reduces that need for recall for additional imaging, those, say, callbacks. What that is when you get that kind of scary letter or phone call saying additional images are needed, you have to come back to the center. Most of the time, those turn out to be nothing, but still that can be a kind of scary endeavor, and if we can avoid that, that's certainly a benefit. Whole breast screening ultrasound is another common supplemental screening study. It does have some great benefits. We know in combination with mammography, it can detect an additional 2 to 6 cancers per 1,000 women screened. Unfortunately, though, while it does detect more findings, many of those findings do turn out to be false alarms or false positives. So again, like mammography, ultrasound's not perfect. There are pluses and minuses to this study. Breast MRI, it's our most sensitive supplemental screening study. In fact, it reveals approximately 10 to 14 additional cancers per 1,000 women screened. Unfortunately, though, like ultrasound, some of those findings may be false alarms, so that is something to consider. In addition, when you have a supplemental or any sort of breast MRI, you do need intravenous contrast, and there can be some risks associated with having contrast. So again, pluses and minuses. Unfortunately, insurance coverage for these supplemental tests does vary from state to state. However, luckily in DC, essentially all or many of these supplemental studies are covered by insurance for all women who have dense breasts. In fact, as I mentioned previously, tomosynthesis is covered for all women regardless of your density. So that's great news. So how do you know if you're dense? Well, most states, again, including DC, have laws on the book that require breast density information be reported to the patient, typically in that results letter, as well as the ordering physician or provider. A little legislative update. In February of 2019, the federal government actually passed a law which says that the FDA has to come up with some sort of universal breast density reporting language that needs to be included in all patient letters and healthcare provider reports. This is great news because really it's going to set a minimum standard for all states. Again, there's such variation in the breast density laws in this country, so this is something that will hopefully make the breast density information and reporting more cohesive. We don't know exactly when this language is going to come out, but it is on the horizon, so something to look forward to. So you find out that you're dense. What should you do? First and foremost, talk to your doctor, specifically about your increased risk, but also about what supplemental tests you may benefit from. Again, like I said previously, none of these tests are perfect. There are pluses and minuses. There's no one size fits all for every woman. So talking with your doctor and really understanding the positives and negatives associated with the test can really help you figure out what is the right test for you. Well, thank you for staying with me for part 3 and part 4. I hope you'll continue on and we'll talk a little bit more about mammography and what cancer looks like on a mammogram. Thank you.